Hello everyone, I did my presentation on early mobilization of critical care patients. This presentation is on early mobilization as it has been seen that this type of practice is safe and feasible in critically ill patients. Approximately 1/3 of patients who are critically ill have ICU-acquired weakness. So the benefits of early mobilization include improved physical functioning, decreased duration of mechanical ventilation, decreased stay in an intensive care unit, and then decreased overall hospital stay. So the big question is, why aren't these patients participating in mobility? Well, current practice shows that a patient should possibly be more medically stable before participating in activity. Staff not understanding how quick muscle loss occurs, and then also not understanding how to mobilize a patient safely. The purpose of this presentation is to explore barriers for not including early mobilization in the current practice, to review what therapy techniques should be utilized, and then to understand how early mobilization can benefit a patient. The research question that I concluded is, does early mobilization of critical care patients increase their functional independence and decrease length of stay when compared to current practice? So the population that I was gearing towards was critical care patients. The intervention would be early mobilization. The comparative would be to compare those who are mobilized versus those who are not mobilized for numerous days, as most of these patients are typically on bed rest. And then the outcome is, does increasing their activity increase their functional independence, and then in result decrease their length of stay? The literature research that I conducted, I used databases on the EBSCO host. My key terms included critically ill and mobilization. This resulted in 455 articles, and then when applying those other limitations, including full article peer review, and within 5 years, that resulted in 142 documents. And then I took it one step further by including rehabilitation into my search. This resulted in about 200 articles, and then after applying those limitations again, I resulted with 39 articles. The rationale for choosing my articles included making sure that it addressed the population that I was wanting, which was ICU or critical care patients. And because of the types of mobilization, that was included in the research. Reflecting on my search, finding generalized articles for a patient in the ICU was somewhat difficult. I kept running into specific diagnoses and more so education rather than the physical therapy practice with specific exercises. Of the articles I selected, 2 of them addressed education and application of education provided. One study applied physical method applied to an intervention group and to a control group. One study completed was a survey addressing barriers in current practice and knowledge about early mobilization. And then my last study was a review of multiple studies relaying their findings in regards to neuromuscular disorders, effects of bed rest, and then the effects of early mobilization. From the conclusions, I kind of split this up. From a physician standpoint, early mobilization is considered a safe and mechanically ventilated patients as long as they are closely monitored. Also, for a physician, mobilization resulted in shorter duration of delirium, mechanical ventilation, and an increase in functional independence at discharge. From a therapist standpoint, I found within my articles that, again, early mobilization is considered safe in mechanically ventilated patients as long as they are closely monitored, which is something that we don't typically do right now. When a patient is on bed rest, incorporating cardiovascular exercise such as a cycle ergometer, which was done in one of my studies. And then lastly, in regards to nursing, some things that I found from the research was education on how to properly mobilize critical care patients could help with this. Education on how to help patients to prioritize mobilization and for them to understand that mobilization is good. And then more staff to allow for mobilization to occur in these units. My approach for synthesizing these articles, so for education, I looked at a study that conducted looking at the the participants that were included, it looked at underestimating the incidence of ICU-acquired weakness, and over half reported a lack of sufficient knowledge on this topic. So that being said, half of those who were in the study did not realize that ICU-acquired weakness happened at the rate that it did. In that regards, for physical therapists, we often go off of a doctor's order to initiate therapy, and in this study, it showed that 39% of those physicians lacked the understanding of early mobilization. This could result in them not placing an order and therapy occurring later rather than earlier. A study conducted by Messer, Comer, Frost, and then also in another study by Castro, Tersavinci, Platts, and Law, it assessed if education provided to nursing staff would increase patients' mobilization. Results found that nurses had improved attitudes towards mobilization, although there were many barriers that they found that didn't allow them to participate in the mobilization with a patient. Things like the time allowed to allot for a patient. So sometimes mobilization can take up to 3 to 4 nurses or staff members, and then this would not allow enough time for them to get their other activities done. And then, of course, staffing issues. It's hard to make time and allow 4 nurses to help with 1 patient. In regards to therapy practice, a study conducted by Kuto showed a statistically significant change for peak pressure and maximum inspiratory pressure in an intervention group who participated in the cycle ergometer prior to therapy when compared to control group with a p-value of 0.03. Something that this study found was that the duration of mechanical ventilation, period of hospitalization, and ICU length of stay revealed no significant difference. However, the study conducted by Chintu here was very small in its numbers, and then from other studies I found that articles did find a statistical significance of decrease in hospital stay when patients were participating in early mobilization. Some challenges that I faced when conducting my research was finding research that was not just survey-based within the last 5 years. I had a very difficult time finding experimental research, testing different therapeutic exercises and the results for this population. Practice recommendations, what I would change: provide education to all staff on early mobilization and its benefits. This includes nurses, physicians, and therapists. Educating nursing staff on how to be more proactive on mobilizing their patients, as well as educating patients on the new practice. Many times we hear that patients are saying they're too tired, they're too sick, they're not feeling well, and we all know that they're not feeling well, they're in the hospital setting. So making sure that we're prioritizing and changing their mindset on mobilization would end up helping them in the end. And then another thing to change was that therapists seeing patients sooner when in a critical care unit. As I said, right now therapists don't typically see patients when they're mechanically ventilated. So changing that mindset and seeing those benefits to help with this population. So potential issues that could occur with changing the mindset of patients, nurses, physicians, and therapists, this might not always go as easy. It's easier said than done, I guess. Many nurses and physicians think that, this updated practice might be too aggressive, so it might be difficult to change their mindset on those things. Identifying when early mobilization is needed. This is something that is needing more research to be done to see when therapy should and should not be included in those type of patients. And then having the staffing available. We all know nurses are understaffed right now, and having sufficient amount of nursing staff would allow for easier mobilization for these patients. In conclusion, early mobilization of patients can be beneficial for the patient as it can lead to decreased stay in the hospital and ICU setting. Current practice needs updated as well as education to be able to provide to all staff on the importance of mobility. And then more research needs to be conducted to relay when early mobilization is appropriate, as well as what therapeutic exercises should be utilized from a therapist standpoint.